Good morning, everybody, and welcome to Health Talk. I'm your host, Dr. Niru Prasad, with my background in pediatrics emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is the teens, opiates, overdose, and the role of Narcan. Joining us today as our guest speaker is Dr. Chris Shreve, and he is a mental health practitioner, and he has so many things according to him, all those accomplishments. So he will share with our viewers all the things that he has done and he's being involved with. Good morning, Chris, and welcome to my show.
Well, good morning, and I'm glad to be back again.
I know, I'm glad that we are doing it in person now. For 2 years, we have been fighting with all this virtual due to the COVID.
But we still got it done. Still got a bunch of shows done during the COVID period.
Yeah, we did good during the COVID.
This is probably about our 15th show.
15, yes. And the COVID also helped me writing my book.
Yes, which is, you said, doing very well.
Which is now endorsed to the UNICEF Foundation.
Yeah, and I got a book done too, so yeah.
And you got your book too,
right.
So both of us have done something.
Right, during COVID, we got something done.
Not just staying home, we did something, both of us.
Absolutely.
So before we get started, can you give your title and everything to our introduction to our viewers?
I'd be happy to. Good morning, good afternoon, good evening. I'm Dr. Chris Allen Shreve, and I'm glad to be here today. I am a mental health practitioner in private practice. I work now out of my home. I used to have a bunch of offices, but now I'm working at home, doing the same things I'm doing, focusing in addiction, trauma, couples, marital, family therapy, just a whole gamut. We have a lot of folks coming in for therapy because I think of what's happening with COVID and just the change in our world. So I've been pretty busy and writing books and doing conferences and here today with you doing a television show.
Good.
So I'm glad to be here.
Very good, and I really like to thank you so much for coming to my show. Because all these things, I look at the NBC, CNN, and all the overdoses happening, and opioids, is going to be #1.
Yes.
Right, with the fentanyl taking over.
Yes, well, that's kind of what the topic of our show today is: teens, overdose, and the use of Narcan. And so, so that's what we're talking about today.
So first question, what is going on with the overdose? I know you brought some beautiful slides that you are going to share with us.
In fact, we can look at the first slide, and the first slide really talks about the rates of overdoses from the last 10 or 11 years. And so you can see that roughly from 2014, you can see a steady uptick up until 2020. And the latest data for 2021 and 2022 show still an increase in these overdose rates. So you can see that other kinds of drugs in our next slide, that was the slide that shows the types of overdoses that have occurred in this same time period. And the blue line clearly indicates the increase in overdoses based on opioids. Pretty much every other drug category stayed stable over the last, over the last 10 to 11 years. So now we can see the increase primarily with opioids, and it went from roughly in 2014, we could see roughly under 10,000 overdoses to now somewhere over 60,000 overdoses in 2020. And those numbers have continued to go up.
Okay.
Our next slide kind of gets more into what we're talking about today, and that's teens, because our focus has been adolescents, and I know you're very passionate about adolescents. And so we see that the 2022 rates for overdoses among U.S. teens has nearly doubled in 2020. And this is probably a lot to do with the COVID, people being home, the effects of what COVID was doing, the losses that people were incurring, and just the change in our life. We also saw in the first half of 2021 a 20% increase as well. So we predict that these numbers are going to continue to increase over time. And as I was telling you before the show, the majority of these overdoses are being tied to street drugs that are laced with fentanyl.
Right.
And as you well know, fentanyl is a very potent synthetic opioid that's 100 to 1,000 times more potent than heroin and morphine.
I think we talked about it last time, but not in details about this laced fentanyl.
Yes, yes.
Yeah,
And that's
but
what
no,
a lot
it's
of
still
young...
the same.
Absolutely. And a lot of teens are unknowing when they're taking these drugs. They're actually thinking they're taking Percocet or, Darvon or some other type of opioid, or other drugs that are being laced with fentanyl, such as cocaine, some of your hallucinogens like
Yeah.
LSD,
PCP.
PCP, and your designer drugs like MDA and MDMA. These drugs are being laced with fentanyl, and so that's also contributing to the overdose rate. Absolutely. So our next slide kind of talks a little bit about what can we do to reverse and take a bite out of these overdoses. And so there's opioid reversing drugs, and the one we're going to talk about today is Narcan.
Right.
Now, Narcan is known as naloxone, and naloxone is basically an opioid antagonist. And so what that means pharmacologically is that the Narcan molecule will sit on the opioid receptor and block the receptor from receiving a opioid molecule. So it essentially renders the opioid powerless in terms of its narcotic effect.
Yeah. There was a very good write-up where they were showing this receptor, how it comes and blocks the
Absolutely.
receptor of the...
And that's the mechanism of action, and that's what stops the opioid from creating the overdose. So when you inject or introduce the Narcan into the person's body, that begins to immediately reverse the effects of the overdose. It's usually, used obviously in emergency situations, in life-threatening overdose situations. And now, because of the fentanyl being spiked in a lot of different drugs, you could see overdoses happening in all kind of places where you wouldn't really expect it. Clubs, parties, people going around in these buses and partying. So, you could have overdoses that occur just about any time, because if any of these drugs are spiked with fentanyl, that can cause immediate respiratory failure.
Okay.
Yeah.
So then I just have one question to ask you, like all these things in the parties stored when they go to the parties, and they get overdose. What is the most significant when they come to the emergency room is looking at the pupils.
Yes, well, there's a lot of...
Look at the pupils, and if it is constricted, we know that it is.
Absolutely.
Am I true about this?
Well, absolutely. There are definitely telltale signs of overdose. And I think that, people should be aware of what those signs are.
Yeah.
And they're, slurred, speech, problems with walking, passing out. They could be also salivating and slobbering kind of thing, as they may be convulsing and that kind of thing. You can hear changes in respiratory issues and that thing. So yeah, there are definitely a lot of signs that we should look out for. So I want to just also continue in saying that you don't need a lot of training to administer Narcan.
Right.
It's an injection or it's a nasal spray. And so if there is a person that is overdosing, it's a nasal spray, which actually they said is a little bit more potent, more concentrated to use the actual nasal spray, because it's immediately absorbed into the nasal mucosal membrane, and then that can be absorbed into the body. So, some people wonder, like, is Narcan addictive, and is there any problems with Narcan? And basically, it's an opioid antagonist, and it's not an opioid at all. So it definitely will block the opioids from working, but it does not cause any addictive problems.
Okay, this is very important to know for our viewers. It is not addictive.
Absolutely. And it's available, at Walgreens and other pharmacy stores, over-the-counter kind of thing. You don't need a prescription or anything like that. And many police officers and firefighters, they routinely carry these Narcan syringes or sprays in their cars and things like that, because this problem has become very widespread, and you don't have a lot of time to really intercede when a person is overdosing, as you well know. You just have so few minutes to really get in there and begin to reverse the effects of the opioid. Yeah.
So by the time the paramedics are called, and if somebody is there at a school ground or wherever, a sports arena, they have already received Narcan. So there won't be too many predominant symptoms due to opioid. Am I right?
Yes, once the Narcan,
correct me if I'm wrong.
yeah, once the Narcan is administered, it begins to rapidly reverse the effects of the opioid. Now, some suggestions say that depending on the level of opioids that they may have ingested, you may have to administer another dose of Narcan, but the recommendation is to kind of wait 10 to 15 minutes to see if they're returning back to, normal vital status, respiration, coming back into consciousness and that kind of thing.
So basically, 2 doses can be given, but there should be an interval of 10 to 15
Yeah, at
minutes.
least, to see if the first dose is going to be effective.
Right. By the time, the patient is stabilized.
Yes,
With, airway breathing, circulation.
Well, the effect should really work almost immediately. Within the first 3 to 5 minutes, you should see some responding. In fact, those who are in those dire states of overdose where they're just about to code out, you should see within 5 to 10 minutes, and I'm not a physician, this is just guidelines, that you should start to see responding. If you don't see responding within that 5 to 10 minutes, it is advised to give a second dose of Narcan.
Second dose.
Yeah. And then by that time, that buys you enough time for emergency responders to get there and then begin to intercede. And also, I think if the person is not breathing, CPR would be appropriate.
Of course,
obviously.
of course. CPR is the main priority.
Yes, because they're not breathing and they're in respiratory failure. And so that can buy some time with the CPR. And if there's any Narcan available, then that can also be administered.
So another question, I was going to ask you, would you advise the family members to keep that for their home? What is your opinion about that? Because the family members, like parents or grandparents, they are already observing, hopefully, their kids, what's going on.
Yeah.
Should they be allowed to keep it at their home, and should they be giving it?
Well, it's a good question. When I got COVID, I got that plaque COVID medication.
Right.
I didn't need it, but it's still in my medicine cabinet.
Right. It's still there.
So it's still there. So I thought you were probably going to ask me that question, and that's a tough question. I think each family has to kind of answer that for themselves. But if you clearly have at-risk kids, if you have narcotics in the house, a lot of elderly and a lot of folks who've had surgeries, have had medication prescriptions that may be 5 to 10 years old and is still in the medicine cabinet. And, back in the earlier days, not to, belittle the medical profession, but there was a lot of heavy-handed prescriptions given out routinely with these narcotics. And so I think now with the opioid crisis, we've all been educated to understand the powerful addictive effects of these medications that only take 3 to 5 days to actually set up an addiction potential with the patient. So now that we're wise to that, I think that really is changing the prescribing protocols. However, there's still a lot of medications sitting in people's medicine cabinets. So to answer your question, I think it's family by family. And I think if it's reasonable, and I don't know what Narcan really costs, but as a preventative precaution, you never know when you might respond to a neighbor in crisis.
Exactly.
And if you see the signs of an overdose, then you're able to respond with the Narcan. So I do think, and in certain situations, it might be appropriate.
Okay. So for our viewers to know, it could be kept, saved in the home. Of course, locked in the medicine cabinet.
Yeah, well, there's no addictive potential. There's no resale value.
Right.
And so it's not an opiate. So nobody would really use that inappropriately unless it was needed to use to intervene in an overdose situation. Yeah.
So that's very good. Do you have any other slides?
Yeah, I think there's a couple of slides.
Yeah. Okay,
and so,
sure. I'm sorry I interrupted you.
Yeah, no, it's okay. We're just chatting here. I think what's important about this whole discussion is that Narcan can be used to help addiction treatment and folks who are struggling with opioid problems. The big thing I think that led to the opioid crisis to begin with was treating pain problems with narcotics. And I think we learned that narcotics are great for acute pain, immediate pain, but not for long-term pain problems. And that's a bigger issue that maybe we can do a show about some other time. But that's where a lot of folks got in trouble with opioids.
Okay.
So, well-meaning people, good folks who just got addicted to opioids that were prescribed by their doctors. And because it was a prescription, they felt that they could take it and there wasn't any problem. So now a lot of folks found out once they tightened up the prescription regulations, and most doctors have to follow very serious protocols to now prescribe opioids. A lot of people were not given opioids that were on opioids. And so then they went into withdrawal, and then they started drug seeking other drugs like heroin and black market opioids. And that's where the fentanyl problem came into play, because now you've got suburban or urban and everybody who was addicted to opiates looking for illicit drugs like heroin and other kinds of pills that are on the market. So a lot of people got caught up. And so the Narcan, in combination with another drug called buprenorphine, created another drug called Suboxone. And Suboxone, and we're not really talking about Suboxone today, but these are three drugs: Narcan, which is naloxone, buprenorphine, and the combination of the two created Suboxone. Those three drugs are used in treating addictions to opioids. And they're very effective in helping patients who have long-term pain problems. For one example, I had a patient who had a knee amputation above the knee, and you know that's much different than below the knee. And so he had a lot of pain issues, legitimate pain problems from the surgery. He came in my office, he was still bandaged. So he was constantly relapsing to heroin because the opioids he was given weren't effective enough for his pain problems. So eventually we got him into treatment, and they put him on methadone, which is another opioid that can help with addiction. But then he eventually got on Suboxone, which was helping his pain problem as well as his addiction problem. So that's an important thing to note, that naloxone, which is Narcan, is one of those two drugs that can help people who have chronic pain issues. And that's what started, I think, a lot of this opioid crisis to begin with.
So your combination of naloxone with
buprenorphine,
buprenorphine.
And there's clinics around that you can go to get medication like Suboxone to get off of heroin, to get off of opioids, to manage a pain problem, and to help deal with a opioid problem if a person developed one while they're treating their medical problem with an opioid. It's kind of a catch-22. So now I think what we learned is that we need to find better drugs to treat long-term pain problems versus giving drugs like Oxycontin, hydrocodone, and other drugs of that sort, because we now see the addictive potential, and then this has led to the overdose problem.
So that's good. It's good to know that we have all this.
Yes.
We have all these amenities now.
Yes, absolutely. I think there's one more slide left, and so. You know, you were talking a little bit about this earlier, and about the signs of overdose. So let's just kind of go through those again, just for our viewers as we kind of wrap things up here. But like you said earlier, pinpoint pupils, and you know, and that's when you open a person's eyes and you'll see that their pupils are not dilating the right way. Extreme sleepiness, almost sometimes knocked out and can't be resuscitated or revived. Loss of consciousness, obviously, and respiratory depression. And so that's really when it's critical. When they're not breathing, that's when we talk about the CPR.
Right.
And that's when you have very few minutes to really administer the Narcan. Because if that person is continuing in their state of overdose, they will eventually die if there's no medical intervention. CPR will buy time until the medical responders get there, and then Narcan can be administered immediately, and that should start to reverse the effects almost immediately. And so basically that's the story about Narcan, and how we can treat overdoses. And our teens are definitely at risk. And I know a lot of schools are now carrying the Narcan in the nurse's office. And that gets back to your question about should we have them in the houses. Maybe, perhaps. I don't think it's that widespread of a problem that we need to, have Narcan in everyone's home. But certainly, if your family has some risk factors, such as kids who've had addiction problems, who may have struggled with opioids, the elderly or the parents who may have pain issues that have opioids in their cabinets, you might want to consider that but first you want to educate your family and your children about the effects of opioids. And I would suggest that if there are opioids in the house, they should be locked up. And I think that that's one thing that we've learned, to really be more responsible regarding the opioids, especially from our teens and our kids, because they can get into those and
they can
take them to school and share. I did a training for all of Royal Oak, 7th, 8th graders.
Okay.
And it was called the the Punch Bowl Party. So I don't know if you're aware of this, but kids would rob their parents' and grandparents' medicine cabinets, bring it to this party, have a big punch bowl, and then pour it into the punch bowl, and they don't know what it is. And then they mix it up, and then they take stuff. And then that's what they would do. And a lot of those kids would overdose because a lot of those drugs were narcotics. Because they didn't know. They didn't know.
And the same thing, like, I published a paper about the salad bowl syndrome, a real story at Mexico on the beach. Saw all these people with a candy in a big bowl. And I was thinking, what is this? Are they real candy? When I walked through, they were all having, sharing this, laughing and giggling.
And not really knowing what they're taking, don't know the dosage, don't know any of the interactions between these drugs. And I think last week they just confiscated a lot of fentanyl in M&M looking candy. So they start to see the fentanyl inside of candy. So, to attract kids to these drugs. So maybe your question is actually more right on point. Should we have these more readily available in our houses?
The title has changed. Instead of salad bowl, now this was a couple of years ago, they published it in American College of Physicians. This one is not salad bowl. Because maybe it's a bigger bowl.
Well, I just came up with the name. Because this was the phenomenon that was happening. That's why they called me into the school, because they had overdoses, and they found out it was happening when kids were taking drugs from their parents' medicine cabinets and mixing it all together and then just grabbing a handful and taking it. Now, that's about as reckless, I think, as you can get.
When you went there, Chris, what was the treatment modality that...
Education and awareness.
Education and awareness, right?
And scaring them to death. But they had already had the reality because their friends had overdosed. This was sort of like a crisis intervention training for the entire 7th and 8th grade. I was there all day to train every class to talk about, one, to process the overdoses, and then to talk about how these occurred and to bring their awareness up. And a lot of these kids had no idea about the dangers of these drugs that they were taking. It was a novelty. It was like something fun. It was blue color, pink color, white color, yellow, and we'll mix it all together and call it a rainbow concoction. But it's a very deadly concoction. Okay?
I think my incidents, I'm talking here, they were all in Acapulco. The bus brought all those kids from high school, everybody's giggling, laughing. So I said, good. I was sitting in the lobby. And when I went to this beach, then I saw them with this thing. So, it's a true story that you tell now it is changed to salad bowl.
Well, it's a sign of our times. A lot of kids are exposed to a lot of things, and we as parents and educators, we need to really stay on top of that. So that's the topic for today. It was Narcan and opioids in teens, and I hope that's helped to educate our viewers about this topic.
So much money has been granted for the mental health services, as you know, towards the education, prevention of all these things.
Absolutely.
So that's very good. I'm so happy that you went into detail about this. And when you talked about immediate Narcan, the picture of an adolescent at emergency room, it's just right there how the kid presented. So I'd like to thank you, Chris, for coming again to my show. I'm so much privileged to have your expertise on my show. I'd like to thank our viewers for watching me. Thank our producer, camera people. And until I see you guys again, have a very safe and a wonderful winter. Thank you again.